Okay, good morning and welcome to today's webinar. Thank you for attending today's webinar, which is the first in our series of bite-sized webinars over the next few months. Today's webinar will focus on drug and alcohol testing, your options explained. I'm Liam Feasey. I'm the Quality and Business Services Manager at Lextox, and I'll be running through today's webinar for you. Before we start, just a bit of housekeeping. So all attendees have been set to mute. So this is to reduce any background noise and to ensure you can all hear me. This is a live broadcast, so unfortunately we won't be able to take any questions during the webinar. But if you do have any questions you'd like to raise, you can please email us at experts@lextox.co.uk and we'll be happy to respond to those queries as and when they come through. Today's webinar will last approximately 30 minutes. It is being recorded and the link to the recording will be shared with you after the event. Okay, so let's begin. So today's webinar, as I said, is focusing on the options available to you for drug and alcohol testing. As this is the first in our series of webinars over the next few months, I'd like to give an introduction to Lextox and just explain who we are and what we do. I'll then talk about the various options available. So to begin with, I'll talk about drug testing, and that really will be about hair testing. Then I'll move on to the alcohol testing. So with the alcohol testing, there's the hair tests, blood tests, and SCRAM continuous testing, and I'll go through each of the three individual options there in respect of the alcohol tests. Okay, so just a little bit about Lextox, first of all. Hopefully, all of you are very aware of who we are and what we do. So apologies if this is a repeat of what you already know. However, for those of you who are unaware of Lextox and what we do, Lextox is a specialist hair testing laboratory with laboratories in the UK. So we specialize in the detection of drugs and alcohol markers in hair samples, and then the interpretation and the analysis of those analysis results and preparing those expert reports for presentation to court. So the analysis that we do is in accordance with the Society of Hair Testing recommendations. So this is an internationally agreed consensus on the best practice for hair, drug and alcohol testing, and which all of our experts are members of the Society of Hair Testing, and we also contribute to that consensus. We are an accredited laboratory to 17025 UCAS testing standards for drug and alcohol testing. So this really provides confidence in the analysis results that we provide, and it ensures the accuracy and the reliability of the testing and the results that we issue. We are one of the first hair testing laboratories to have confirmation of Lab 51 compliance. So Lab 51 is an extension of the 17025 UCAS testing standard, and it's a document that outlines the technical procedures that toxicology laboratories must comply to. So it is an extension of the 17025, and we're very proud that we've got that Lab 51 compliance as it's an extra level of quality adherence that we comply to. We're trusted by over 17,000 clients right across the UK. And as I said, I'm the Quality and Business Services Manager at Lextox. So I've got over 20 years experience of working in the laboratory, quality assurance and reporting analytical results to clients. Okay. So we'll move on to the various options available. So I'll start with the drug testing. Now, hair testing for drugs is very useful in profiling drug use over a period of time. Scalp hair grows at approximately 1 centimeter a month. So a 3 centimeter section of scalp hair will give you approximately 3 months history of an individual's drug use. So hair is very good in a single test, profiling a number of months. So that hair section can actually be broken down into individual monthly sections. So what that will provide is a sectional month-by-month analysis, and that's really useful for trending drug use over a period of time. So we'll be able to see if the levels are detected increasing, decreasing, or intermittent. So it can really be used to build up a trend of the drugs detected over the tested time period. Now, with a hair test, we can go back as long as the hair allows. So this is dependent on the length of the hair. So a 12 centimeter section of hair, for example, would cover 1 year's approximately of an individual's drug use. Now, the maximum section that we can analyze as a whole section is 3 months. Anything longer than this can actually compromise the sensitivity of the test. So if we do go back 12 months, the hair test does have to be broken down into individual sections, either 3 centimeter sections or 1 centimeter sections, covering that period of time. So it is a very good test for profiling a history of drug use over a number of months. Now, to obtain drug use more recently, i.e. over the past few days or the past week, really an oral fluid or a urine test would be beneficial, as they cover generally the past few days up to about 4 days, whereas hair will only cover a number of months, and it won't be able to pinpoint it specifically which day the drug was used, but it is very useful for trending drug use over a period of months. Now, there are occasions when an individual may not have sufficient scalp hair to undertake the analysis, in which case body hair is a useful sample to analyze in those instances. Now, with scalp hair, it has a relatively consistent growth rate of approximately 1 centimeter a month. Now, that can fluctuate from individual to individual, but the population average is 1 centimeter a month. Now, with body hair, the growth rate can vary, and that does depend on the site of the body hair and where that body hair is located on the body. But another thing to notice with the body hair and to take note of is that it has a different growing phase to that of scalp hair. So with scalp hair, approximately 85% of the hair is actively growing. So that's why we can do a much more defined time-resolved analysis. But with body hair samples, the amount of hair that is actively growing is greatly reduced. So it's about 50%. So about 50% is actively growing, 50% is resting phase hair, so it's not growing on the body. So we have to take that in consideration when we're doing a body hair sample. So with a body hair sample, generally the hair will cover between 4 and 18 months, and the time period is much more approximate than that of scalp hair. But a body hair sample is very useful if there is no scalp hair, and it is just as accurate and it's just as sensitive. We can still detect the drugs. It's just that the time period is a lot more approximate than that we would for scalp hair. Now, with a body hair sample, we have to analyze it as an overview analysis. It can't be segmented into the month-by-month analysis that we can do with scalp hair samples. So we do, when the body hair sample is received, we examine the length of the body hair, we measure it, we establish an approximate time period, and we analyze the whole of that sample. For drugs analysis, we can analyze any body hair, but for the alcohol markers, we can only analyze body hair from the chest, arm, or leg regions. So it's slightly different for the alcohol testing. Now, in respect of the drugs that we can detect, there's a list of those drugs present on your screen. I won't go through every single drug group, but what I will say is that the drug that we look for and the test that we do is very sensitive and specific. So if we see that particular drug, it can only be that drug and it can't be anything else. So any medication or any over-the-counter remedies would not give a false positive for any of the compounds that we detect. So say, for example, if we detect cocaine, it can only be cocaine and it can't be anything else. So the test that we do is very sensitive and specific, and it targets that specific drug. Some individuals, they may have dental treatments where they're administered benzocaine. Now that does sound very similar to cocaine, but it's not cocaine and it's completely different. So as I said, if we find that drug and that drug is present in the hair, it can only be that drug and it can't be anything else. So what I'd like to say at this point is that we have developed methods to detect some legal highs. So these are psychoactive substances. So we've developed a method to look for the most commonly used legal highs in that group. So these have been manufactured to mimic the effects of some of the illegal substances. And then we've also developed a method to look for synthetic cannabinoids or spice. So again, that's very different to actual cannabis itself. Now, as well as looking for the parent drug, we also look for substances called metabolites. So a metabolite is a substance which is produced by the body when the actual drug itself is present in the body. So when an individual ingests a drug, that drug is present in the body, and then that drug is then broken down, and in that breakdown process, other compounds are produced, and it's those breakdown products that are called the metabolites. So the presence of a metabolite helps to confirm use of that drug. So on the screen there's two that we look for as an example for cannabis. So we look for 11-hydroxy delta 9 THC and 11-nor-delta 9 THC 9-carboxylic acid. So if either one of those are present in the hair sample, that helps to confirm the use of the drug. Now, you don't have to specifically request the presence of the metabolites. We automatically look for them when we do the analysis. But they're very useful for you to look out for when you receive a result from us and you're going through that report. It's very useful to look out for the presence of those metabolites, and it should be clearly detailed in our report if they're detected or not. Okay. So moving on to the alcohol testing. First of all, I'd like to start with the hair alcohol test that we do. So with the drug testing, we're actually looking for the actual drug. So it's definitive. We're finding that drug in the hair. With the alcohol test that we do, we're not looking for alcohol. We're looking for two products that are produced by the body when alcohol is ingested. And these are ethyl glucuronide, which is ETG, and ethyl palmitate, which is ETPA. So when alcohol is ingested, the body breaks down alcohol and produces ETG and ETPA. And both of these biomarkers are then incorporated into the hair. So the test that we do is very specific for those two biomarkers. Now, the hair alcohol test is there to show chronic excessive alcohol consumption. So this really is the regular consumption of alcohol over a period of time. So chronic excessive alcohol use is defined as 60 grams of alcohol a day, which equates to 7.5 units of alcohol on a daily basis, which would equate to roughly depending on the alcoholic volume, roughly 4 cans of regular strength lager or a bottle of wine on a daily basis. Now, over the course of a week, that would be 52.5 units of alcohol. So an individual could abstain from alcohol at the beginning of the week, but then consume 52.5 units towards the end of the week. And if they were doing that every week within the time period covered by the hair alcohol test, then that would be expected to give a result for chronic excessive alcohol consumption. Now, something to note with this test is that if it's a not detected result, we're not saying that there's no alcohol consumed. What we're saying is there's no evidence of excessive alcohol consumption. So an individual could still be consuming alcohol, it's just not at a level to be above the cutoff for chronic excessive. Now, with the hair test for alcohol, it's an overview analysis. With drugs, we could break it down into the monthly individual sections to get a trend. But with the alcohol test, it is an overview. We look for the whole section. So this would be a 3 or a 6 month analysis as a whole. And we wouldn't be able to say exactly what day alcohol had been consumed, i.e. if it was every Wednesday, Thursday, Friday, Saturday of every week within that period of time. It's just an overview analysis for that 3 month or 6 month period. And the hair alcohol test, the maximum time we can go back is 6 months. And that's due to the stability of the ETG and the ETPA markers in the hair sample. With drugs, we could go back as long as the hair allows, but for alcohol, it is a maximum of 6 months. As I said, with body hair, for the hair alcohol test, it really is only in the chest, forearm, and the leg regions to look for the alcohol markers. And we do recommend that the hair test is used in conjunction with the blood tests, which I'll move on to now. Okay, so there's 3 blood tests that are available to, again, help assess chronic excessive alcohol consumption. So these are carbohydrate deficient transferrin, which is CDT, liver function test, and phosphatidyl ethanol testing, which is PEth. So the CDT test and the PEth test are both biochemical markers looking again for chronic excessive alcohol consumption. So really these 2 tests are looking generally at the past 4 weeks prior to the sample collection. So when used in conjunction with the hair test, you can get a very good picture of somebody's excessive alcohol use, because the hair test could cover an approximate 3-month period and the blood test would cover the past 4 weeks. So the blood test is really covering more recent alcohol use. And you potentially could get 2 different results. The hair could be detected, for example, and the blood result could be not detected. Now, it's not saying that one result is right and one is wrong and they're not conflicting. It's just that they're 2 very different tests looking for 2 different time periods. So in that scenario, it could be that the individual historically over the 3-month period has been consuming chronic excessive levels of alcohol, but more recently, through the blood testing, there's no evidence that the alcohol consumption has been recent. So they could more recently have reduced their alcohol intake. So that's why it's very good to combine these tests to get an overall picture of someone's alcohol use. Now, the liver function test isn't alcohol specific. So other factors such as medication, health conditions can affect the liver function. So we recommend that the liver function test isn't used in isolation and it's used alongside other tests to build up an overall picture. And the liver function test is providing a snapshot in time of any potential liver damage through alcohol use. So it's just at that moment in time that the sample was collected, if there's any damage to the liver. And that's because the liver can repair itself over a period of time. So historically, an individual may have damage to the liver through alcohol use, but then potentially a few weeks later, the liver could actually repair itself and that damage could have actually been repaired, and there's no evidence of any damage through excessive alcohol use. So there's a number of tests there that can be used to help build up alcohol consumption. And as I said, the CDT and the PET are generally the past 4 weeks. So some of our clients will have a number of blood tests over a course of a number of months. So they'll have a blood test every month. And that kind of helps in continual monitoring of somebody's alcohol use. Now, another form of monitoring is SCRAM. So SCRAM is Secure Continuous Remote Alcohol Monitoring. So this is very good at continually monitoring somebody's alcohol consumption. The hair and the blood are very good at looking back historically, so trying to profile what's previously happened, whereas SCRAM is continuous monitoring. So this records any alcohol consumption subsequent to and following the SCRAM device being fitted to the participant. So the SCRAM device is a device which is worn on the ankle, and it tests for alcohol that is excreted through the skin transdermally via sweat and perspiration. So what happens is when an individual consumes alcohol, the alcohol is broken down. The majority of the alcohol is excreted through urine, but a very small percentage, 1% of alcohol, is excreted across the skin through sweat and perspiration. And the SCRAM device detects that alcohol in the sweat and perspiration. And it tests that every 30 minutes of every day. So it's very good at building up a profile of somebody's alcohol consumption. So a base station unit is fitted at the donor's participant's home address, and this communicates with the base with the SCRAM device fitted to the participant twice a day. So it records any readings that the SCRAM device has recorded, and then it builds up the picture of alcohol consumption over time. So the SCRAM device has tampering technology, so it can detect if there's been any tampering events or any obstructions or any removal of the device. And the fitting and the removal of the device can only be undertaken by one of our trained Lextox sample collectors. So this is to ensure that the process is simple and straightforward for both yourselves and the participant. The device will need internet capability at the donor's participant's home address in order for us then to obtain that information. So this is the sort of profile that we will get and report to you from the SCRAM testing. So if we look at the top graph, if we look at the black line, we can see that we have very clear peaks. So this is indicative of consumed alcohol. We can see that the level detected, which is the transdermal alcohol concentration, is increasing to a peak and then decreases as alcohol is then eliminated from the body. The red line is the temperature and the blue line is the infrared distance. So both of those are used to help identify any tampering or obstruction events, which will also be reported in the reports that we issue. So in the top graph, we can clearly see that between that time period, that there's been daily alcohol events through that tested time period, which looks to be about a week. And that's the sort of profile that you'll get from the result. The bottom graph, The black line is very vertical. It's a straight line. So what this is indicative of is environmental alcohol exposure. So this would indicate that the individual has used a product that contains alcohol in and around where the device has been fitted on the ankle. So that gives a very different alcohol reading. So it's a very straight line. So we can tell the difference between consumed alcohol and environmental alcohol exposure. And these graphs will be included in the report. If there's alcohol events, we will go through and explain those alcoholic events and compare them to the drink drive limit. And how many times above the drink drive limit the transdermal alcohol concentration has detected has been. And then we'll also outline any tamper events or obstruction events if any of those have been recorded. Okay, so to conclude, Lextox is a specialist hair, drug and alcohol testing laboratory. We provide hair, drug and alcohol testing specifically for family law and child protection casework right across the UK. We also offer blood alcohol testing to complement the hair testing that we provide, which would be CDT testing, liver function, and PEth tests. We also offer SCRAM continuous alcohol testing to get a profile of alcohol consumption. And this webinar is part of a bite-sized series of webinars covering a number of options, testing options, over the course of the next few months. So I do hope that you found today's webinar very useful, and I do hope that you join us on our next webinar, which is sample collections and how to prepare your donor and the importance of chain of custody. So that will take place on Wednesday, the 18th of May at 10 a.m. So I'd like to take this opportunity to thank you for your time today. Again, I hope that you found it was very useful. We will be sharing this recorded after the event. And again, if you do have any questions that you would like me to answer, please send them through to experts@lextox.co.uk.